everyone, my name is Max, and today I'll be demonstrating how to explore the lingual surfaces of tooth number 29 and 30 using the 11 and 12 Explorer. To begin, I'm seated at the 11 o'clock position, which is ideal for working on the mandibular posterior teeth that are facing away from me. I have the patient's head tilted slightly towards me, and I'm using my mirror to help me see the surface. Let's first talk about how to establish the modified pen grasp. I'm using my thumb and index finger on opposite sides of the handle, holding it gently but securely to maintain control. There's a slight space between them to avoid pinching, and the handle rests between the second and third knuckle of my index finger usually, which is curved into a soft C shape. For this area, I actually have my pen resting further behind my third knuckle. My middle finger is placed on the functional shank, helping me guide and feel the vibrations of the Explorer, and my ring finger acts as the fulcrum, resting securely on a nearby tooth, and in this case, 2 or 3 teeth away from where I'm working on, so on the incisal edge of tooth number 27 or the occlusal surface of 28. This fulcrum provides stability and acts as the pivot point for movement. Now let's talk about selecting the correct working end. I'll place the Explorer on the distal surface of tooth number 30. The terminal shank should be parallel to the long axis of the tooth, and the functional shank should curve up and over the tooth, not across the lingual surface. If I flip my Explorer to the side, this alignment is incorrect. The alignment ensures I've got the correct working end, so like this. Let's begin on the distal lingual surface of tooth number 30. My fulcrum is on the occlusal surface of tooth number 28, providing control as I begin to explore. I adapt the working end of the instrument to the distal line angle and begin using small controlled strokes, and these will be oblique strokes. Oblique strokes are generated by a gentle wrist motion, which activates lateral pressure along the side of the Explorer tip. As I reach the interproximal area, I begin to pivot, a motion that comes from my fulcrum, finger, and wrist. And this pivot causes the tip to roll around the line angle, allowing me to maintain adaptation as I move into the distal surface. And once here, I switch to vertical strokes, still small and light, to carefully explore the interproximal space. The goal here is to get the tip halfway into the contact area without causing trauma to the soft tissue. Rolling the instrument is done by using the thumb and index finger in tandem, and they rotate the handle slightly, which turns the working end so that the tip stays well adapted as I move around the curve of the tooth. This is critical for keeping the side of the tip against the tooth surface rather than the point, which helps detect plaque and calculus while protecting tissue. So let's now move to the mesiolingual surface of number 30. I reestablish my fulcrum, this time on the buccal surface of tooth number 28, and approach the mesial line angle with my tip adapted. My elbow starts away from my body and gradually moves in as I continue toward the mesial. I begin with a pulling back, elbow in, pulling back, elbow in, pulling back, in motion at the mesial line angle. And as I approach the mesial interproximal space, I again use a combination of pivot and roll to sweep the tip into the contact area. And once there, I use vertical strokes, keeping the terminal shank as parallel as possible to the tooth's long axis. This parallelism ensures that my strokes are effective and anatomically correct so that I don't hurt the patient. Now on tooth number 29, starting with the distal lingual surface, my fulcrum is placed on the incisal edge of tooth number 27, providing good visibility and control. And just like before, I adapt my working end to the line angle and use small, light, oblique strokes. And as I approach the distal surface, I begin to pivot and roll, and I roll the handle with my thumb and index finger, keeping the tip adapted and transitioning into vertical strokes inside the contact area. Finally, for the mesial lingual of 29, I shift my fulcrum to the facial surface of tooth number 27, depending on comfort and access. I approach the mesial line angle with the Explorer tip, again using the pulling back, elbow in strokes, followed by a roll and pivot into the mesial contact. Once in the space, I apply short vertical strokes, ensuring the Explorer tip hugs the surface closely. As we know, exploring is a tactile skill, and the goal is to detect any calculus, irregularities, or rough surfaces, and we'll use it mostly in the assessment appointments or during periodontal charting and prior to any procedures such as scaling to ensure thoroughness and a way to look back and reflect. It's important to know the modified pen grasp, using the correct working end, and using ergonomic principles to ensure that you are using the modified pen grasp correctly, not pinching, that your fingers stay in contact, and you know how to pivot and roll and what to do with your elbow so that you do not have any musculoskeletal issues down the line. So thank you so much for watching. I look forward to hearing your feedback. Thank you for your time.